Yesterday, warning of a long, hard winter, as he put it, because of the pandemic, and also calling for unity. What else stood out in his remarks?
Well, we've heard Biden give that warning before, and what was striking is the focus that he placed on the coronavirus in his pre-Thanksgiving remarks before heading from Wilmington up here to Rehoboth Beach, Delaware. We also heard him, though, talk about the death toll, but as it relates to families' potential emotional toll, sitting at a table at Thanksgiving dinner this year with one chair empty, Biden said that that's something, unfortunately, he knows how to deal with all too well. His wife, Dr. Jill Biden, echoing that sentiment in a video that they released on Twitter this morning. Listen to what they said.
So many people are celebrating this year knowing that someone they love will never again take their seat at the table. Joe and I know the pain of that empty chair. If you are one of those families, please know that our hearts are with you and that you know that you aren't alone.
We might not be able to join our hands around a table with our loved ones, but we can come together as a nation.
To me, Joshua, more than anything else, those remarks yesterday, as well as the remarks that they delivered via video on Twitter today, were showing a president and a first lady in waiting that we're going to step into the empathy gap that has been lacking from the White House in the midst of this crisis. You compare the way that Joe Biden has spoken about the coronavirus over the course of the last few weeks to the way that we've heard President Trump talk about it over the course of the last few months. Trump has had a tendency not to dwell on how bleak it sometimes feels, but instead to put a rosier picture on it. Biden yesterday really leveling with the American people, speaking to the frustration that many of them have because of this ongoing pandemic and the fact that now we're getting into the holiday season and a lot of people are being forced to scale back. That's also true for the Bidens. Biden referenced that he should be, or usually is, in Nantucket with lots of family around him. This year, that's not what they're doing. They're doing a much smaller Thanksgiving here in Rehoboth Beach.
And very briefly, Ali, before we got to move on, how much is the president-elect thinking about whether this pandemic could become the dominant theme of his administration, particularly as it relates to who his cabinet picks are?
Yeah, well, it's clear that it is definitely the thing that is overarching for his transition. And given the way that experts talk about this, this is going to be the reality and the top issue that he's contending with, at least over the first year and a half of his presidency. But there's also the ability for it to be a real legacy moment. They're not looking past it yet. They are very much focused on how you can combat it. But at the same time, this is something that's very similar in some ways to the crisis that Barack Obama stepped into with the economic crisis in 2008, Joe Biden involved in that response. This, of course, has an economic component to it because certainly Biden has said that you cannot get the economy back on track without first focusing on the coronavirus.
Right.
And so clearly it's of top importance to him, but also on the staffing front. Consider some of the people that he's put up here. His incoming White House Chief of Staff, Ron Klain, was Barack Obama's quote-unquote Ebola czar. And Alejandro Mayorkas, the person who he's nominated to be the head of the Department of Homeland Security, was also involved in dealing with the Zika crisis as well as the Ebola crisis. So he's starting on a personnel level to show that this is a policy priority, but also that he's putting a premium on experience.
We'll talk more about the coronavirus response and about Michael Flynn as the hour goes on. But for now, NBC's Carol Lee in Washington and Ali Vitale at Rehoboth Beach, Delaware. Thank you both. Now, this pandemic continues to infect members of President Trump's inner circle. Most recently, another lawyer for his campaign. According to the New York Times, that makes at least 45 people closely connected to the White House who've tested positive. Meanwhile, 13 states still do not have a statewide mask mandate. Each is run by a Republican governor. So even though the election is over, the politics of this pandemic may for some time. One Washington Post reporter who endured COVID-19 wrote about her experience. Jackie Alemany noted the differences in what some of her GOP sources were saying publicly and what they told her privately. Jackie writes the Washington Post's Power Up newsletter, and she joins us now. Also with us is Dr. Vin Gupta, an affiliate assistant professor at the Institute for Health Metrics and Evaluation. He is also an MSNBC medical contributor. Good to see you both. Jackie, let's start with the piece that you wrote. You wrote in part that one Hill staffer for a GOP lawmaker encouraged you to share your experience with COVID-19 because according to the staffer, their boss still doesn't think it's real. You also wrote that a Trump campaign staffer told you, quote, "It's pretty incredible that even when people do get it, it doesn't change their behavior very much. If anything, it just emboldens them that they made it through the virus. It blows my mind," unquote. Jackie, I don't mean to put too fine a point on this, but it sounds like they're calling some folks in their party hypocrites.
That's exactly right, Joshua, and happy Thanksgiving. Thanks so much for having me. And I just have to say, I'm so thankful for all of the doctors and frontline workers who are keeping everyone safe, especially after having experienced this firsthand and being completely flattened by it. Thankfully, I wasn't hospitalized, but I was really struck by the dissonance between my private conversations with my Republican sources and what we're seeing in terms of the public rhetoric and the continued politicization of the coronavirus pandemic from Republican leaders and governors. And what I was hearing from my sources was frustration with their boss's behavior and with their colleagues' behavior as well. I was talking this through with a source. As I was laid out on the couch, I spent the majority of my time recovering sleeping. But when I wasn't sleeping, I was trying to work the phones to the best of my ability. And as you noted, they really encouraged me to talk about this because, again, their boss didn't believe in it. We're seeing that rhetoric continued in places like South Dakota and Oklahoma and Missouri. Governor Kristi Noem and Oklahoma's governor as well, who are actively encouraging behavior that is against the warnings that we're hearing from people like Dr. Fauci and our nation's top public health experts as our death count and cases are hitting highs that we were seeing at the beginning of the pandemic. It's not going unnoticed by Republicans who work for these people.
Before I get to Dr. Gupta, Jackie, it's clear the Biden administration's approach to this virus is going to be very different than the Trump administration's approach has been. What is your sense of how Mr. Biden might move past the politics to try to put forth an effective response?
Yeah, well, I do think, as we've seen with a lot of the public opinion, Americans do overwhelmingly support masks and are moving, albeit slowly, past sort of this partisan warfare that masks have become in our public dialogue. That being said, I do think that the president-elect has to tread lightly in terms of what sort of national federal mandates he might impose. But as Ali noted, he has selected a number of cabinet members and leaders, has already assembled a coronavirus task force, people who are experts in dealing with this, who are epidemiologists and who have managed global crises and domestic crises before. And so that is something that they're working on day in and day out, especially, in terms of thinking about the consequences of, trying to scale back on the politicization of a public health crisis.
Dr. Gupta, let me ask you about where we stand right now. The U.S. reported 2,000 more deaths yesterday for the first time in months. That is something that your institute predicted. Deaths are climbing, but according to CDC data, the share of cases that result in a death has dropped steadily from 6.7 in April to 1.9% in September. What does that tell you about where we are right now?
Well, we're in a very, very precarious situation, and none of what we're expecting after the holidays is preordained, Joshua. So let me say that right now. Let me just speak to the American people and say, if you've traveled, first of all, it's not too late. If you're planning on a Thanksgiving dinner with individuals that you do not actually live with in that same household, you can cancel. It's the right thing to do for your health and the health of your loved ones. That's one. If you've traveled recently or you're going to convene with somebody that you don't live with, mask in their presence to the extent possible. Try not to gather around one dinner table. Just do what you can to maintain social distance and mask in their presence. That's going to be really vital. And then clean high-touch surfaces in the kitchens, in bathrooms, on tables. Make sure that you're using some sort of disinfectant wipe. That's going to be really vital to do that, especially if you've decided to convene with other people you don't normally live with. So that's going to be vital. And then lastly, what I'll say here is just 2 points here. Number one, I've seen, unfortunately, people just wear face shields in the absence of masks. You want to wear masks? Absolutely. That is vital. Face shields is an additional layer of protection if you want to add that, but don't think face shield is a substitute for a mask. And then lastly, a question I get, Joshua, all the time, because testing, to your initial question, is so constrained right now.
Yeah.
In a lot of places, Testing is only available if you're symptomatic. If you're asymptomatic but know you have COVID-19, get a pulse oximeter. Check your pulse, your oxygen level a few times a day. If it's less than 94%, these aren't hard and fast guidelines. Call your doctor, get some sort of medical attention. That's one thing to look for. High temperature above 104.
Right.
These are things you want to keep an eye out for.
An oximeter sounds like a good idea. By the way, that's OXIMETER. For those of you who are sitting at your computer like oximeter. OXIMETER. Very quick question, doctor. Can I get your opinion real quickly on this AstraZeneca vaccine? AstraZeneca and Oxford acknowledged yesterday this manufacturing error that raised some questions. It was a group of volunteers. They got a lower dose of the vaccine, but the lower dose seems to be more effective than 2 full doses. Briefly, doctor, before we got to go, what more do we know about why that happened? What do you make of that?
Well, we don't know a lot because they only put that data into a press release. And so the big question here is the AstraZeneca vaccine actually effective in older individuals? I think the initial data in the press release format draws some concern about whether it's truly effective in that older population. So more to come.
Dr. Vin Gupta and Jackie Alamani of the Washington Post, good to see you both. Thanks very much. COVID-19 has food banks struggling to keep up with unprecedented food insecurity among families. We're live at a distribution center in one of the nation's wealthiest counties. It's second in unemployment behind Las Vegas. We'll take you there just ahead on MSNBC.